Now regarding the blood supply of the spleen. Now the arterial supply. What are the important blood vessels near to it? On the posterior aspect we know that this is the abdominal aorta. At the level of T12 L1 you are going to have the celiac trunk. L1 level you are going to have superior mesenteric. L3 level you are going to have the inferior mesenteric artery. Okay. Now the celiac trunk, what were the important branches? We had three important branches. What all are they? One was the hepatic artery, common hepatic artery is there. Okay. Then what did you have? You had the left gastric artery was there. Okay. Then what did you have? You had the, what is this one? This is a splenic artery. And is it just a straight line? No, it's having a kind of a tortuous course going over there. And where does it end up? In the hilum of the spleen. It's going to end up in the hilum of the spleen. And where is the splenic artery going to be passing along? It's going to go on the superior border of the pancreas. Why do you have such a tortuous course? What is right above you have the diaphragm there. So while your diaphragm is moving up and down, you have the movement also of the spleen is occurring to a certain degree. While this movement is occurring, it must be moving a bit. So you need the artery. If it is just a tight artery over there, it cannot accommodate much movement of this organ. So to accommodate the movement of the spleen and of the pancreas, the related structures there, you have a tortuous course for the splenic artery. Now the splenic artery, before it reaches into the hilum, it's going to divide into quite a number of branches over there. These branches are going to enter into the spleen. Now the spleen is covered by a capsule. If you remember your histology, the spleen was one organ which had a capsule trabeculae. It didn't have an outer cortex and an inner medulla. It just had two important things which you remember. Complete parenchyma is mainly the red pulp, and then you have small locations of white pulp. Red pulp means it's full of RBCs, looks red, so you are going to call it as red pulp. Now how does this blood or RBCs, all these, enter into the spleen? Through the splenic artery, through its branches. These branches will finally, what will it do? It will finally end up in very thin, narrow, long arteries called penicilli. Okay, these penicilli are going to end up in small capillary networks. They'll end up in small capillary networks. Now, after this, there are two theories. One is that it directly enters into the spleen. Directly the blood is going to enter into the spleen, go into the red pulp, okay, go all over into the sinuses, okay. So that kind of a circulation is called as open circulation. Okay. Now, so there is another theory in that it goes through these capillaries and then it goes across closed structures and then goes to the venous system. That is, it is going through a closed system. Okay. But what is now accepted is that it has still here, it is a closed circulation, and after that it is a open circulation. It enters into the sinusoidal spaces, and then from the sinusoidal spaces it will be received by the venous spaces, the venules, and then the veins. Okay, so finally what will happen? It will be received by the small veins, large veins, and finally it will be received by the splenic vein.